I've talked about the mineral magnesium in prior videos, but today I want to talk about some of the common signs that you could sense in yourself or notice about yourself, which can tell you that you're probably low in magnesium. And the reason I'm making this video is because I'm coming out with a new super magnesium supplement. No, I'm just kidding. I'm not selling any magnesium supplement. The reason I'm making this video is because at least 50% of Americans, and probably all around the world, don't even get the minimal daily requirement for magnesium. Magnesium, the requirement in adult males, for example, is 420 milligrams a day. For women, I believe it's something like 400 milligrams. And most people don't even get those amounts. And I'll talk about the reasons why later in this video. But just briefly, why would you be concerned about magnesium? Well, magnesium opposes a lot of effects, a lot of the bad effects of calcium, such as excessive calcium deposition in soft tissue. Magnesium is involved in blood pressure control. ATP, the most elemental form of energy produced by cells. Everything, carbohydrates, fats, all calories eventually are converted into ATP. That's the immediate energy source of cells. It turns out magnesium is needed to stabilize ATP. It's very important for energy production. So one of the symptoms of not getting enough magnesium is fatigue, because again, you're messing around with your ATP production. Magnesium also has a kind of synergistic effect with the popular supplement creatine, which is also produced in the body from 3 amino acids, glycine, arginine, and methionine. But the point being, magnesium is involved in actually promoting enzymes that are involved in creatine metabolism. Of course, you probably heard I've said in prior videos, magnesium itself activates over 300 enzymes in the body. It's extremely important mineral, and it's very likely that a lot of people are deficient in it. Now, the thing is, if you have a blood test for magnesium, it's very rare for people to show up deficient. In fact, less than 2% of Americans are estimated to show an outright magnesium deficiency. Of course, if you're in the hospital and you're in a critical care unit, something like that, if you have diabetes or if you drink a lot of alcohol, then you have a greater chance of showing an outright magnesium deficiency. But here's the problem, though. That 2%, where they say 2% of Americans have show an outright magnesium deficiency, it's based on a blood test called serum magnesium. But this blood test only measured the magnesium that's circulating in the blood. And most of the magnesium is involved intracellularly, where it's not measured by that test. So you can have a normal serum magnesium level and yet be completely deficient in magnesium. So you can't go by that test. That test. As I said, there's various causes of magnesium deficiency. Certain types of diets, if you eliminate foods that contain magnesium, which I'll get to later on, that can cause a magnesium deficiency. It's probably the most common cause of lack of sufficient magnesium is because of not consuming enough in foods, because magnesium is not in a lot of high protein foods. It's more likely to be found in plant foods, fruits and vegetables. And if you don't eat those foods, there's a high likelihood that you're not ingesting sufficient magnesium. There's a big trend now for people to take higher doses of vitamin D. There's been studies showing that vitamin D helps minimize the side effects of COVID-19. People that are replete in vitamin D, meaning if they have high levels of vitamin D, active vitamin D in the body, the activated form is called 25-hydroxycholecalciferol. Basically, it's a steroid hormone. If you have a high level of that, if you are unfortunate enough to be infected with COVID-19, they've shown in recent studies that you're very unlikely to wind up in the intensive care ward on a respirator. That you'll get sick, but you probably won't die if you have pretty good vitamin D levels. So because of that, and because of all the publicity about vitamin D preventing various diseases, a lot of people take vitamin D supplements, which is great. I mean, they're tiny little capsules. They're very easy to take. The problem in relation to magnesium is that the more vitamin D you take, the more it can deplete magnesium in the body, because magnesium is needed to convert the, let's say, vitamin D inactive form into the hormonal form. And the more vitamin D supplement you take, the more magnesium is going to be used up in converting vitamin D in its active form. So that alone, just taking a lot of high doses of vitamin D, can cause you to have low magnesium. And some of the other, I'm just going to go, I have a list here. I'm just going to go down just to be complete. I'm going to just list the other, according to medical studies, these are the things that can cause a magnesium deficiency. If you take a lot of the drug Tylenol, acetoaminophen it's called, that's the generic name. If you take large amounts, that can cause magnesium excretion. If you drink too much alcohol, that can cause magnesium. If you ingest somehow too much aluminum or get it from environment, that can cause it. If you have high levels of aldosterone, which is a steroid hormone secreted from the adrenal glands, aldosterone is usually caused by, for example, a intake of too much sodium, that type of thing. That can cause excretion of magnesium. Aging itself can cause a low magnesium because of the when you age, you get a condition called hypochlorhydria, which is where the parietal cells of the stomach don't secrete sufficient amounts of acid, and that affects both protein digestion and mineral absorption, including magnesium. Antacids, some of the popular medical ones, ranitidine, famotidine, these can cause they bind to magnesium, cause them to get out of your body. If you've had bariatric surgery for overweight, obesity, that causes they basically do like an intestinal bypass, which prevents you from absorbing magnesium. You would definitely need to take a magnesium supplement. Taking too much calcium, or for example, taking too many calcium supplements can also cause an imbalance where magnesium is lost. Too much caffeine, if you drink a lot of coffee causes excretion of magnesium. Celiac disease causes it. Chronic stress, this affects a lot of people. Chronic stress, magnesium is involved in helping protect your body against the effects of stress. So if you're under chronic stress from any source, you're losing magnesium all the time. Every time you work out hard, you're losing up magnesium, because again, it's involved in energy production, it's involved in muscle contraction. So when you work out hard in the gym, you're losing magnesium. If you have type 2 diabetes, with high glucose levels, you can lose magnesium. Every time you have diarrhea, you lose magnesium. If your diet is too high in fat or sugar, you lose magnesium. If diuretics is another that's something that a lot of competitive bodybuilders do. To lose water, they take diuretics to eliminate sodium, but along with the sodium, you also eliminate other minerals, including potassium, magnesium, and you can get a really quick magnesium deficit if you take high dose diuretics. If you're using supplemental forms of magnesium that are poorly absorbed, such as magnesium oxide, where it's less than 10% oral absorption, if that's your main source of magnesium, you can be in trouble because you're not absorbing most of it. It can cause diarrhea also. If you're taking, for example, women on estrogen therapy, that causes a shift of the magnesium to the soft and hard tissues, lowering blood serum levels, which is not that bad because it doesn't mean you're losing it. Excessive or prolonged lactation, or breastfeeding if you're a woman, fasting or a low magnesium intake, that can cause it. Certain drugs, which I'm not going to get into, if your thyroid's too fast, hyperthyroidism, that can cause magnesium excretion. Any type of kidney disease can cause loss of magnesium. Heart failure, if you're on a kidney machine, if you're taking in too much phosphorus in the diet from, let's say, drinking soda or phosphates that are found naturally in food, that can cause a imbalance where you lose magnesium. Elevated insulin levels, hyperinsulinemia from too many processed carbohydrates, or if you're insulin insensitive or insulin resistance, that can cause a loss of magnesium. The insulin resistance actually depletes the magnesium from your inside your cells. That's where it's most important. If you take laxative, you have too little sodium intake can cause Too low a selenium intake can cause magnesium deficiency. If you have any kind of liver disease like cirrhosis, if you have, if you're pregnant, pregnancy can actually lower magnesium levels. If you're using drugs to control ulcers called proton pump inhibitors, they cause a magnesium loss, which can lead to heart disease. As I mentioned earlier, strenuous exercise. If you're deficient in vitamin B6 or pyridoxine, that can cause magnesium deficiencies. So what are some of the let's talk about now some of the actual signs and symptoms, the more easy ones that you could look for in yourself that would tell you that you're low in magnesium. Muscle twitches and cramps. Years ago, when I wasn't consuming enough magnesium, I used to get this thing where my eyes would twitch all the time. I just couldn't figure out what was causing it. Of course, no physician was able to give me the answer at all. But it turns out that I suspected, after doing some research, I realized I was not eating the foods that contain sufficient amounts of magnesium. I started taking a good, well-absorbed magnesium supplement. The eye twitch disappeared. It's never come back since. Muscle cramps. The people who take diuretics, like I say, competitive bodybuilders, a lot of the muscle cramps they get, you see them cramping backstage, on stage, where they can't even flex. A lot of that's caused by a huge loss of magnesium caused by the diuretics. In a worst case scenario, you can wind up getting seizures or convulsions if your magnesium gets too low. Because what happens is, when you don't have enough magnesium, you get a greater flow of calcium into the neurons or nerve cells. That overexcites or stimulates muscle nerves, and that could lead to the severe cramps, seizures, and convulsions. So that could, as I said, the twitches and cramps. That's an early sign of magnesium. Certain mental health conditions, apathy. If you just don't feel like doing anything, nothing excites you. You just feel like a living zombie. That's because of the way magnesium affects energy production. So that's one sign. Of course, it can be caused by other things. Magnesium is also associated with increased risk of depression. I mean, low magnesium. Because magnesium has a relaxing effect on the nervous system. If you don't get enough magnesium, you might get the opposite effect. You might get anxiety, excess anxiety. If you have not getting enough magnesium, you'll get greater chance of having anxiety. So another one in women, especially in women, osteoporosis, usually associated with a lack of calcium and estrogen. Also associated with the aging process. Osteoporosis starts at age 30, usually becomes apparent when a woman hits between 50 and 60. She'll get spontaneous fractures. She'll be walking up the stairs, a hip will fracture, she'll fall down the stairs, that kind of stuff. Or they can get fractures in their upper vertebrae where they kind of walk bent over. You see these old ladies walking like that. That's osteoporosis associated with a lack of calcium, not enough estrogen, also a lack of vitamin D and vitamin K, which is needed to metabolize vitamin D. But magnesium is also a risk factor for osteoporosis because it can directly weaken the bones, and it also lowers, when you don't get enough magnesium, you get lower levels of calcium, which is the main building block of bones. So then, of course, I mentioned earlier, several times I mentioned the fatigue and muscle weakness. Fatigue can come from various sources. You can get tired from not enough calories. You can get tired from overtraining. There's a lot of reasons, but magnesium also, because of its involvement in energy production and 300 different enzymes, it can cause a type of weakness, but the weakness usually is directed mostly in the muscles. So your muscles will actually get weaker if you don't get enough magnesium. And interestingly enough, the muscle weakness caused by magnesium is actually caused by the loss of potassium in muscle cells, because you need magnesium to absorb potassium into muscle. They kind of work together. If you take potassium, you have to take magnesium with it, just like you have to take magnesium with vitamin D. Another sign of where you're not getting enough magnesium, and again, this can involve, there's many causes for this: hypertension, high blood pressure, Animal studies show that when the animals are deficient in magnesium, it increases their blood pressure. I've known a couple of people that, famous trainer who passed away a couple of years ago, he blamed his high blood pressure on, he had a genetic problem where he wasn't able to absorb the normal levels of magnesium. It also gave him a heart attack, but that was a genetic problem that he had. But magnesium does help to lower blood pressure, especially if you already have high blood pressure. Asthma. Asthma is usually the symptoms that are produced by asthma. I have asthma, so I know it's a tightening of the bronchial tubes where they constrict, and you feel like you can't get enough air. It's a horrible feeling, believe me. I've been in so many emergency rooms over the years. I haven't been in emergency, thank God, for years, because I control the asthma with drugs and exercise. But magnesium relaxes smooth muscle on the blood vessels by relaxing the smooth muscle. Now, smooth muscle is involuntary. You can't control it like voluntary muscle, like a bicep and tricep. Smooth muscle you cannot control by yourself, but it can be controlled by nerve impulses and certain electrolytes by magnesium. Magnesium tends to relax smooth muscle, and the thing that causes the constriction with asthma is a tightening of the smooth muscle in the bronchial tubes. And it turns out that magnesium can help prevent that, because it prevents the overstimulation of the smooth muscle in the bronchial tubes. And another way that magnesium helps, it helps prevent the buildup of calcium in the muscles that line the airways to the lungs. If you get a buildup of calcium in there, that can cause the bronchial tubes to constrict also. In some cases, they actually give people with asthma an inhaler that contains magnesium sulfate, and it works really well. I mean, it gets the magnesium directly in the lungs, and it's not the best way to treat asthma, but it actually will help. It could possibly prevent a severe asthma attack. Another real serious possibility that shows you not getting enough magnesium is an irregular heartbeat known as arrhythmias. That's probably one of the most serious possible side effects of insufficient magnesium. The possible symptoms. How do you know you're having an irregular heartbeat? Symptoms include lightheadedness, shortness of breath, chest pain, fainting, dizziness, and fatigue. Arrhythmias are also associated, for example, atrial fibrillation is a type of arrhythmia that occurs in the upper chamber of the heart. The biggest danger of atrial fibrillation, it induces a 5 times greater risk for having a stroke, because with atrial fibrillation, which is an irregular conduction of the electrical waves in the heart, it starts in the upper chambers, as I said, but this causes the development of blood clots in the heart that can get into the blood, travel to the brain, and cause a stroke. That's why people with atrial fibrillation, unless they're treated, have a 5 times greater incidence of strokes. So, let's see. Again, this association with potassium in and outside heart muscle, that's associated with a magnesium deficiency, and that could also explain why the lack of magnesium causes the arrhythmias, because it doesn't let's say the control of potassium within the heart cells doesn't work right without enough magnesium. People with congestive heart failure and various heart arrhythmias have been shown to have lower magnesium levels. So, as I said, the requirement. Let me see here. I just there's some other clinical signs of magnesium deficiency. Aggression. I mentioned anxiety. There's something called Trovik's sign, which are twitching of the facial muscles in response to tapping the area of the facial nerve. Doctor will take a little hammer, tap that. You get a certain twitch. That's indicative of a magnesium deficiency. As I mentioned, cramps, muscular weakness. I already talked about these. These are all medical signs. And the vitamin D resistance. Now, as I said earlier, the requirement, the recommended daily allowance for magnesium for males 51 years and up is 420 milligrams. For women, I got it wrong. It's actually 320 milligrams for women. If you're between 19 and 30, you want to get at least 400 milligrams for males, 310 for females. and 9 to 13 years of age, it's 240 milligrams of both males and females. So that is not the optimal amount, though. Because of the loss of magnesium when you work out, when you sweat and do all these things, people who are involved in exercise should be taking closer to something like 800 milligrams, at least twice the recommended daily allowance. And big warning, do not take large amounts of magnesium at once. Even the ones that are better absorbed, such as magnesium glycinate, if you take amounts larger than 200 milligrams, it has a very potent laxative effect. If you take a large amount, you're going to be going to the bathroom a lot, I'm telling you. So don't try to keep each individual dose of magnesium to be 200 milligrams or less. And I got to tell you, I take doses of 200 milligrams of magnesium glycinate, which is considered one of the best absorbed forms. It's supposed to not stimulate bowel movements, but let me tell you, it does. It does. I don't care what they say. Every time I take that, within a half hour, I have to go to the bathroom. It goes without fail. So be aware of that. You've probably heard of milk of magnesia. That's a laxative, and there's a reason why it's called milk of magnesia, because it has magnesium in it to make you go to the bathroom, basically. Now, where do you get magnesium? Well, it's in plant and animal-based foods, but the richest sources are seeds and nuts. Whole grains contain magnesium, beans, leafy green vegetables. Again, a lot of people avoid these foods because they're worried about carbohydrates or whatever. But just to give you an example, here's the magnesium content in about 100 grams or 3.5 ounces of some of the best natural magnesium sources. If you eat 3.5 ounces of almonds, it'll give you 279 milligrams of magnesium. If you eat 3.5 ounces of pumpkin seeds, you'll get 550 milligrams, a nice dose. If you eat dark chocolate, not the milk chocolate processed crap, dark chocolate, you're getting 220 milligrams. Get 176 milligrams of peanuts. Even popcorn gives you, in 3.5 ounces, you get 140 milligrams. So other good food sources of magnesium: flax seeds, sunflower seeds, chia seeds, cocoa, coffee, cashews, hazelnuts, and oats. So I think that's about it. Let me see how long this video is going here. Yeah, it's 22 minutes, so I'm going to close off for now. But I wanted to do this video because so many people, especially active people, I mean, you would think that active people would be more conscious of mineral intake, but they don't realize how easily magnesium is lost. And again, if they get that lab test, it's almost always going to show normal magnesium levels, but that's serum. That's the magnesium in the blood. It's not reflective of the magnesium in tissues. So, like I said, only 2% of people or less show low serum magnesium. Those are the ones that are really sick. They're like, they have like serious illnesses, or they're heavy alcoholics, something like that. Most normal people will always show up normal magnesium. It doesn't mean that you have optimal magnesium levels. Even if you don't get enough sleep, any kind of stress, any kind of hard exercise, if you take diuretic, you're throwing magnesium out of the body. You got to replace it if you really want to be healthy, prevent disease, and have maximum energy. So that's about it for magnesium. Signs of magnesium deficiency, I should say. If you want more information on nutrition, exercise science, anti-aging research you can use today, practical stuff, not this, stuff, stem cells will replace your brain crap. I'm not going to talk about stuff that's not available. I'd rather discuss stuff you can do now to help slow down. You can't stop aging no matter what anyone tells you. You got these pie-in-the-sky videos I see where these scientists are talking about how there's going to be a time where aging is a disease and we're going to be able to stop aging altogether. I say bullshit. I've been studying aging for 20 years myself. Trust me when I tell you, the problem with aging is it's multifactorial, meaning there's so many different causes of aging. If you control one, you got to deal with about 15 others. It's very difficult to control all of them, but there are ways to actually do control all of them where you don't eliminate, these causes of aging, but you basically control them to the extent where you really will slow down the aging process, especially the outright appearance of aging, like skin aging, wrinkling, loose skin, that kind of stuff. Exercises are involved, of course, too. So that's what I talk about, the anti-aging and applied metabolics, effective fat loss techniques, which fat loss techniques really work, which are the best diet, which are the best exercises. I also talk about ergogenic aids, from some drugs and vitamins, minerals. I also talk about hormonal therapy such as testosterone replacement therapy. Believe it or not, there's always some new information coming out about that. Talk about how to combat elevated estrogen levels if that's all of this stuff is in applied metabolics. In fact, nobody, as far as I know, covers as many topics as I do in applied metabolics. I mean, some people cover nutrition real well in digital publications. Some people cover exercise very well. I mean, these people have advanced degrees. I'm not going to lie to you, their stuff is pretty solid evidence-based stuff. The only problem I see, and I'm not trying to be overly critical here, these people are not writers. I'm a professional writer. I've been writing, if you look at my background, I was a science editor of Muscle and Fitness for over a decade. I've been writing for 45 years. I know how to write for the public. These people don't. They wrote their dissertations that were written in sciencese, a lot of technical terms, and unfortunately they can't get out of that habit. And when they do their digital publications, it's like they're still writing their PhD dissertation. So unless you have a science dictionary or a science background, reading that stuff is like wading through thick mud. You won't have that with applied metabolics because I know how to write. It's written in a magazine style. I'm not going to weigh you down with all this technospeak stuff. It's written in plain English. As long as you made it through the 6th grade, as long as you're literate, meaning that you know how to read simple English, you will have no problem with applied metabolics, and you'll be able to read it. It's 30 to 50 pages, all right? That's because it's very in-depth. I mean, these videos are nice, but these are all superficial. I can't get into it. Otherwise, they'd go on for 4 or 5 hours. I'm not going to do that to anybody, especially when you consider that the human attention span for videos has been lab tested to show it maxes out at 20 minutes, and here I am at 27 minutes. I've probably lost about 3/4 of my audience, but what can I tell you? Sometimes I go over. I try to aim for 20 minutes. But if you really want to learn something, subscribe to Applied Metabolics. I guarantee, no matter what your level of training experience or education, you will learn something every month at Applied Metabolics. www.appliedmetabolics.com. When you subscribe, they'll send you an invitation to join my private Applied Metabolics Facebook page, where each day I post new information on nutrition, exercise, general medicine. It's only for subscribers. I also have an email portal on my Applied Metabolics webpage. Again, only for subscribers. Can send me short questions, which I'll be happy to answer as a appreciation of the fact that they are subscribers supporting my work. And for that reason, I do not answer unsolicited questions because I only have a certain amount of time, and it's going to always go to my subscribers first. So that's about it. If you want to have the best friend you'll ever have, go to your local shelter, adopt a dog. Real quick though, I don't think I mentioned the video. If you're wondering what is, I've mentioned this in past videos, but I'll say it again. The best form of supplemental magnesium, if you want to go that route, if you feel you don't want to eat those foods that contain magnesium, is magnesium glycinate. Magnesium glycinate, and if you want a little bit better thinking ability, this one's a little bit more expensive, but there's one called magnesium threonate. Magnesium threonate is more like a brain magnesium. It was actually developed by scientists at the Massachusetts Institute of Technology. Most of the magnesium that you consume orally does not get in the brain. Magnesium threonate, it's attached to threonate, which is a metabolite of vitamin C or ascorbic acid. It actually pushes it into the brain, so you get a 15% greater elevation in the brain of magnesium. Doesn't sound like a lot, but it makes a huge difference. It actually stimulates the growth of new dendrites, which are the connections between neurons. Basically, to make a long story short, it keeps your brain healthy, especially if you're older. If you're having a little, what they call senior moments, if you're over 40, taking magnesium threonate could help that. But I warn you, it's not cheap. It's probably the most expensive magnesium supplement that you can get. I only use it once a day myself. I take it before I go to sleep. I take 3 capsules. Anyway, that's it. Take care. Thanks for listening. If you've come this far, thank you for listening. Take care. Oh, by the way, did I forget to say it? If you want to have the best friend you'll ever have, go to your local shelter and adopt a dog.